So in order to understand the different types of dizziness, I think it's quite important to understand a little bit about how the balance system works. It's not overly complicated, but the way that we balance is that we take inputs in from our body in terms of nerve impulses from our sensation in our feet, in our bottom when we're sitting on a chair, and also from our joints and muscles. This then goes up to the brain along with inputs from the eyes and from the ears. The brain then coordinates all of those three main inputs, and it sends out messages to the body, mainly to the muscles, to tell it how to balance. And that's basically how the system works. Now, if anything goes wrong in any of those systems, then you have dizziness or imbalance. So, for instance, you can have a problem with the neurological system. So if you're diabetic and you can't feel your feet, then you will feel off balance when you stand up. If you have some dysfunction of your brain, which might be due to a variety of things, simply maybe hyperventilation due to anxiety, for instance, then the brain doesn't function so well and you may feel off balance. If you have visual problems, then you will often have balance problems in particular situations where the visual environment is demanding. And if you have an ear problem, then you will also feel off balance, and that can either be an acute situation where the room suddenly starts to spin around, which we call acute vertigo, or you can have a chronic situation where the balance mechanism in the ears is sending the altered messages into the brain and you feel generally off balance. So the most important thing about sorting out a problem with dizziness is the history. So it's really important to sit down with the patient and to understand exactly what symptoms they're having. And it can be really helpful if the patient comes along with a list of the symptoms that they've had and the time scale, because both of those are really important in helping make a diagnosis as the cause. Once we've gone through the history, then every patient will have their ears examined, including a hearing test, and then they'll have an assessment of their balance. And they may have some other investigations in the clinic, depending on those findings. And after that initial consultation, then it's usually possible to make a diagnosis, or at least a differential diagnosis, to tie the diagnosis down to a few possible causes. And after that, we may organise some other balance-related tests. There are two main tests that we organise. One is an MRI scan of the brain and of the ears, and another is what's called caloric testing, where we test the function of the inner ears from a balance perspective to see if both ears are working and if they're working equally or not. So dizziness means that the balance system is not working properly, and that may be because there's a dysfunction of the nerves going up to the brain, of the brain itself, of the ears, or of the eyesight. A progressive onset of loss of balance, where it just gets progressively worse, that would be quite concerning if it had been going on for more than about 2 weeks. An acute episode of imbalance, for instance, where the room spins around, where recovery back to normal hasn't occurred within 6 weeks. Both of those scenarios, so the progressive dizziness over a short period of time, or an episode of dizziness that doesn't recover within about 6 weeks, they would merit further investigation, and usually by an ENT surgeon or a neurologist. So if someone has an acute vertigo and they are incapacitated and vomiting, then it will be reasonable to seek medical attention straight away, because a doctor can intervene by giving an anti-sickness tablet or an anti-sickness injection, and that can relieve the acute phase very well. If someone is worried about their balance and they feel that they're at risk because of that, for instance, of falling over, then similarly they should contact their general practitioner to discuss that, and they may be referred. And if someone is having a deterioration in their balance which is otherwise unexplained, then also they should seek medical attention. I think we need to split dizziness up into vertigo, which is the perception of movement, and disequilibrium or impaired balance. If we look at vertigo, where the room spins around, then an inner ear attack, what we sometimes call vestibular neuronitis or acute vestibular syndrome, is probably the most common cause of dizziness. And the next commonest cause will be a thing called benign paroxysmal positional vertigo, where some crystals or debris in the inner ear get stuck in the wrong position. Less commonly, you can have Meniere's disease or a recurrent vestibulopathy causing recurrent attacks of dizziness. If you look at imbalance or impaired balance, then the most common cause would normally be age-related and just usually due to a general deterioration in a person's ability to stand and balance. That's probably the most common cause, but we also see people who have migraine, which affects their balance, and people who get anxious and hyperventilate, and that also can affect your balance. So in terms of perception of movement in the acute phase, if the room is spinning around and you're feeling sick, then seasickness type tablets can be very helpful and in relieving symptoms. In terms of chronic imbalance, then usually a balance exercise is often overseen by a physiotherapist, usually the most helpful treatment. In some circumstances where you get recurrent episodes of acute dizziness, which is disabling, we do put people on other tablets to try to prevent the dizzy episodes, and occasionally we can inject medication into the ear itself, which can be helpful. In terms of acute episodes or sudden episodes of vertigo, there isn't usually much that a patient can do to prevent those. Sometimes doctors prescribe tablets such as beta-histine or inject steroid or gentamicin into the middle ear, and that can be helpful. In terms of general imbalance, then often balance exercises and practicing the movements that you find difficult can often be helpful. And in terms of everybody's balance or improving balance on a long-term basis, keeping yourself fit is really important, because you need strong muscles to balance with. And if you don't keep your muscles strong as you get older, unfortunately, your balance will deteriorate more quickly.